Hello, thanks for joining me. My name is Linnea May Huxford, and I am going to give you the quick rundown on what LADA diabetes is. So the whole thing is that it's latent. Latent means it's coming on gradually, slowly. It may come on over many years or even decades, a very slow progressing form of diabetes, and that is why it is often misdiagnosed as type 2 diabetes. The big thing is the root cause of a lot of diabetes is an autoimmune attack on your pancreas, on the beta cells in your pancreas. Now, it's an autoimmune condition, which is just like type 1 diabetes. It is the type 2 diabetes, which is the most common type of diabetes, is not autoimmune condition. However, it's sometimes confused because at the gradual nature, the symptoms and what it looks like to your doctor often is type 2 diabetes. And so it can be assumed that you have type 2 diabetes. And depending on which study you look at, the rate of this is humongous. Anywhere between 5 to 20% of all people who are diagnosed with type 2 diabetes actually have LADA diabetes. It's really astounding. This is not a rare condition in their typical sense of rare diseases, because if it's 10% of everybody with type 2 diabetes, we're probably looking around 53 million people worldwide. And it makes a big deal. It is a big deal because misdiagnosis means ineffective treatments. It can lead to a lot of frustration as you try to do everything right, and the medication, you've taken the medication, you've changed your diet, your exercise, and your A1C, your blood sugar keeps going up. Because of the presentations of the symptoms, it's often referred to as type 1.5. There's actually quite a few types of diabetes. There's actually a type 5 diabetes that is a new type they just came out with. But LADA, they say, is type 1.5. And I would argue it would be better to describe LADA as a subtype of type 1, since the root cause is the same as type 1. But yeah, type 1.5 is the other word for LADA diabetes, or you can say LADA diabetes. It doesn't matter how you say it. But LADA is an autoimmune condition, and it is 100% possible to screen for this, which is my big message to get out to everybody, that you can do a simple blood test to find out if it's type 2 diabetes or is it LADA diabetes. The blood test, there's a couple of blood tests. There's autoantibody panel is the key one. Tests for 4 different autoantibodies. The GAD65 is the autoantibody that is most commonly present in LADA, but it's possible that you'll find in your results that some of the other antibodies are present. And then also the C-peptide test. And so the C-peptide test is also a blood test, and that measures it gives a proxy for how much insulin is your body producing, because every time insulin is made, a C-peptide molecule is also made. This is how doctors can determine how much insulin you are making, whether it's a normal, typical amount, or whether you're making less or more. And this is a big difference here, because in type 2 diabetes, in the early stages, your body actually usually is producing more insulin because you have insulin resistance. Whereas in type 1 and LADA diabetes, your body is actually producing less insulin. It's producing less insulin because the cells that are in your pancreas are not able to make insulin because of this autoimmune attack. So insulin is a critical hormone that everybody needs. They often say it's the key that lets the sugar in your cells so that your cells can produce energy, and therefore all of your metabolic processes, you can live because you have insulin. So, and in diabetes, it's a failure of those beta cells in type 1 diabetes and LADA diabetes that cause the high blood sugar. And the treatment is insulin. And I am so thankful that insulin is available. It exists. It's only been much more than 100 years since insulin's discovery. It was in 1921 that insulin was discovered, and that treatment with insulin saved the lives of people with type 1 diabetes. And the scientists on my shirt, Banting, Best, Khalip, and McLeod, those are the scientists who discovered insulin. Very thankful for this. and they've saved millions of lives. A very typical story of somebody with LADA diabetes is that they are diagnosed with type 2 diabetes. They're given medication for type 2 diabetes. In my case, I was given metformin, and often the medications do work to an extent, at least initially, because it's a gradual process. And especially if you change your diet and increase your exercise, if you choose to go to a low carb diet, you may see improvement. But what happens is over time, as this gradual condition progresses, your body is no longer to produce enough insulin, and then what you'll see is you'll see an A1C number going back up and getting more high blood sugar. So I mean, I had an A1C of 11.5 when I was first diagnosed, and taking metformin and following a really low carb diet, much lower carb than I do today, less carbohydrates and exercise, and my blood sugar went down to about 7. However, it did not stay there. It never got lower than that. And then even with a lot of work, because, you know, I was really trying to beat this diabetes, but it did not stay there, and it started going up, and then I was prescribed another medication, and then that didn't work, and my blood sugar kept going up, and then that's when I saw an endocrinologist, and I got the correct diagnosis and on the right treatment plan. The treatment is insulin, and it is in treatment with insulin was a relief, because it actually worked. It solves the problem, although it's also a very challenging thing because it is hard to dose the insulin correctly. The dosages can be, for somebody with LADA diabetes, in the early stages, your body is still making some insulin, so you may only need a little bit of external insulin. So it is challenging, and I have many videos here on YouTube about all of those challenges. But for this introduction video, I just want to say, if you want to know what to ask your doctor about, if you're thinking maybe I was misdiagnosed, or maybe you know somebody who maybe they were misdiagnosed, there are some clues of signs to look for that might make you think, oh, this diagnosis of type 2 diabetes doesn't exactly fit. I should ask my doctor for these blood tests and make sure that it really is type 2 diabetes and not a different kind of diabetes. So go to my website, LADA-diabetes.com, for a free checklist of what you should be asking your doctor. The LADA Doctor Checklist has instructions about what you should do before your appointment, at your appointment, including 10 questions to ask your doctor that can really help to get the right diagnosis, and then what to do afterwards as well. So LADA-diabetes.com, free checklist, absolutely free, and then you can see if that's what you have, and get on the right path if it turns out you're misdiagnosed, or if you know somebody who's misdiagnosed, or if you're listening to this and you're a medical professional. This is a really big thing that you could help so many people to get them on the right treatment path as early on as possible. And what's remarkable is today there is screening. There's screening for these autoantibodies, and they're finding that they're present actually before the symptoms ever start. So if we had screening early on, if more people got screened, then we could really prevent this whole misdiagnosis problem. So LADA-diabetes.com is where my free LADA Doctor Checklist is. And also, please subscribe while you're here on YouTube so you don't miss anything. And share with anybody, your doctor, friends, family. There's a lot of people dealing with this misdiagnosis issue. And if you have a story to share, I like the more perspectives, the better here, because it's not just my story, right? It's a story of many millions of people, and they all have different pathways, and their story, maybe that will help people see the full picture of how it can progress, what the early symptoms are, how it goes missed. So yeah, if you want to share your story in the comments, I really appreciate that as well, and it'll help many people. Thank you very much.